As the world looks toward the new year, a different kind of storm is sweeping across the Pacific. It's December 28, 2025, and from the shores of French Polynesia to the islands of Samoa and Yap, health systems are currently in a red alert state. We are witnessing a rare and dangerous double threat, a massive surge in influenza colliding with a record-breaking dengue fever outbreak. In some regions, hospitalizations have spiked by 50% in just 7 days. Today, we're going inside the Pacific Emergency to look at the evidence, the numbers, and why the next few weeks are a race against time for the most vulnerable. Let's start with the breath in our lungs. In French Polynesia, a red alert for influenza was declared just days ago. In a single week, cases jumped by 50%, with 46 people hospitalized and patients in intensive care. The culprit? Influenza H3 and 2. But it's not just the high-end resorts of Tahiti. Over in the Federated States of Micronesia, specifically the Yap Outer Islands, the situation is even more dire. Cases of influenza-like illness doubled in a week, bringing their total to over 569 since mid-November. The most heartbreaking data point? The most affected age group is children aged 0 to 4. In Wallis and Futuna, masks are once again mandatory in healthcare facilities as the threshold for an epidemic has been shattered. While the flu attacks the respiratory system, a second enemy is attacking the blood. Samoa is currently enduring one of its worst dengue seasons in history. As of December 2025, they have recorded over 16,161 cases. That is staggering for a nation of its size. Over in the Cook Islands, the Ministry of Health has been on a blue alert since May. We are seeing something called co-circulation, where both the ENV1 and N- serotypes are present at once. Why does that matter? Because if you've had one type of dengue before, catching a second type increases your risk of dengue hemorrhagic fever, a life-threatening complication where your blood vessels leak and your platelet counts plummet. In the Cook Islands, the 10 to 19 age group is being hit hardest. Authorities are now engaged in massive cleanup and spray campaigns to kill the Aedes aegypti mosquito before the rainy season makes things even worse. Why is this happening simultaneously? It's a mix of environmental and biological factors. 2025 has seen record-high humidity and rainfall in the region. Flooding and rising sea levels aren't just climate headlines, they create millions of tiny breeding pools for mosquitoes. Simultaneously, we are seeing immunity debt. After years of varying travel restrictions and isolation, the Pacific populations are more susceptible to new viral clades. For example, the H3N2 subclade clade that hit New York so hard this month has also found its way into the Pacific hub of French Polynesia.
The response is now whole of government. From the Integrated Vector Control Committee in Samoa to the WHO experts deployed to Tonga earlier this year, the focus is on two things: source reduction and early detection. The message from the islands is clear: eliminate the water, wear the mask, and trust the evidence. If we can't flatten these twin curves, the small island healthcare systems may face a total collapse before the start of 2026. I'm your host for the Evidence Edge. We will keep you updated on the Pacific Emergency as the data comes in. Stay safe and stay informed.